and welcome to another episode of Tea and Tales. I'm your host, Megan Taylor, a veterinary physiotherapist and animal lover. And today with me is Dr. Cristina, veterinary neurologist.
Hi, how are you? I'm happy to be here with you today.
Thank you for coming. If you can tell everyone a little bit about yourself and your background and why veterinary neurology is important to you. And before even I get into that, I forgot to introduce the topic. The topic we're going to speak about today is so important and so misunderstood by so many people and pet owners, vets, everyone. It's epilepsy.
Epilepsy, yeah. Well, I'm Dr. Cristina. I've been working as a vet for the last almost 13 years. I think as soon as I finished the university, I did an internship with a lot of European diplomats, and then is when I think I started falling in love of neurology. And as soon as I finished the internship and the residency, I did a master for a couple of years, just focus only in neurology, and then I passed the exam for the master itself, for the postgrad. And since then, I'm just been working as a neurologist here and in Madrid too.
How many years have you been in modern vet now?
Almost 5 years, I will say. Wow. Time flies. Yeah, time flies.
All right, can you introduce everyone to the concept of epilepsy? What is it, to start with?
Well, epilepsy is not the same as a seizure. Everybody...
That's such an important distinction to make.
Everybody books an appointment with me saying that, oh, my pet has an epilepsy, and actually epilepsy is the disease, okay? And seizures, we always explain to the owners that a seizure is just a clinical sign. So same as you have vomiting or diarrhea, it doesn't mean that the vomiting is a disease, so you have to try to figure it out, the reason behind those seizures. So yes, we can say that the epilepsy is the disease and the seizure are just the clinical sign.
Okay. And to give epilepsy kind of like blanket statement of what is it then?
I think we can divide epilepsy actually in 3 different big groups.
Okay.
The main one or the one that everybody thinks their pet has is idiopathic epilepsy. That is mainly a genetical epilepsy. But we have 2 other big groups, and that's why the test, the examination, even a conversation with the owner are so important, as we have what we call or what they are divided in structural epilepsy, mainly tumors, inflammatory disease, head traumas, even congenital disorders, and then the reactive epilepsy. Those, for example, kittens that have low glucose, or they have hypoglycemia, or even liver signs that they can have neurological signs. So it's really, really important to make sure in which group are you, because the treatment and the prognosis is completely different.
It's interesting. There's so many people, I'm sure, just kind of like,
yeah,
epilepsy.
Yeah, it's a general word, like epilepsy. No. We have to really specify in which group you are so we can treat you properly.
And is it more common in dogs or cats, or you see the same in both, or each group, as you said, is more common in each one?
Well, I think in Dubai, actually, we have more cats than dogs. So, but even though I think it's more represented, I think, in dogs, to be honest. I think most of my consults, 60-70% of them are epilepsy, and I would say 60% of those are dogs mainly, yeah.
And you kind of mentioned already there's a kind of a genetic response. Is there breeds that are more likely to get it, or you see more commonly coming in
Yeah, in cats it's not that well known, to be honest. But the poor things, we are a little bit late on. Yeah, so true. In dogs we have more studies, and yes, we have few breeds, for example, French bulldogs, or even huskies, German shepherd, which even on that group of genetical epilepsy or idiopathic epilepsy, we know that few breeds, at these last 2, German shepherd and huskies, they are super difficult to control, okay? They are really, really difficult, and even though if it looks like an easy case, you have to, or the owner needs to be aware that be prepared, because it's not going to be an easy journey.
Do you know why that is, or it's just the pattern of the huskies? And
it's a genetical predisposition.
And they just don't respond well to the medicine, or just like everything starts to change?
It's more, you have more chances to develop what we call refractory epilepsy. That means that the typical protocol or the normal dosage are not really working, so they respond worse, and they have, I would say, poor control of the seizure, sadly, yeah.
Okay. And what are the most common causes then of epilepsy in pets? Is it caused by something?
Well, this is a difficult question, because as I said, it depends a little bit on which group are you. I will say that that most of them, thanks God, are part of that big group of idiopathic epilepsy. So you don't have a main reason behind more than your genes. but yes, the point is that we most of my patients or when they reach to me, they are diagnosed by that idiopathic epilepsy, and sometimes they are not well controlled, and it's because either you don't have epilepsy and you have a movement disorder that we can speak about it later, or maybe because you have something else. You have a meningitis, you have an intracranial tumor, you have something congenital that can be fixed by surgery. So that's why sometimes they are not responding well, but depends on which group are you. You have to really do a very good protocol for the diagnosis.
Okay, because you always hear a lot of people kind of like afraid of, I don't know, some things causing epilepsy. So is there truth behind this? Or?
No, well, I have a lot of owners that they have their own explanation
yeah,
why.
that's what I mean. People come in like, oh, well, he had that, and that's why
like, I'm
he had
pretty
seizures
sure it
after
was
this.
because I was on vacation and then he wanted to have a... No, poor things. It doesn't work. It doesn't work like that way. It's true that, for example, more in cats than dogs, we have some kind of seizure that they can be triggered by movement or even sounds. In dogs, we have, for example, Lafora disease, that is a degenerative disease of the brain, mainly in dachshunds, that they respond to the light, okay? So sometimes this...
That was what I was going to ask, because in humans as well, it's like the trigger of the light. So is that
It's
applicable
the
to dogs?
same. It's not always... In idiopathic epilepsy, mainly, you're not going to find it. Neither, for example, if you have an inflammatory disease, a meningitis, or even a tumor, but few specific diseases that can produce seizures, okay, that we call a structural epilepsy, that big group, yes, they can be triggered by lights or even sounds. Stress, it's not well defined, but we really think sometimes it can be triggered also by stressful situations. Yeah, more in dogs than cats, to be honest.
Wow, it's very interesting.
Yeah.
So can you let us know, what do seizures look like in pets? Because like you kind of already said already, some people will think their pet's having a seizure, but they're not.
But they are not.
What should owners look for? Like, this is the sign of a seizure.
Yeah, so well, the typical seizure, I will say, is a pet that maybe few hours or even few minutes, even days before the seizure, they start changing their behavior, and then they just...
Is there like something to look for a change of behavior, or just a general change of behavior, like quieter, more active?
That's a difficult question, because each pet or their aura, that is these signs before the seizure, are completely different. So a few cats, they hide more. A few dogs, they are hyperactive. Sometimes you feel that they are more needy. Sometimes they are completely normal. I really think that at the beginning it's quite difficult to understand the pattern, and most of the times my owners are able to say, like, Cristina, this week I'm pretty sure my dog is going to have a seizure.
They always know best, trust your gut.
Yeah, because they know their pet. They are part of their family, and it's easy for them to understand when something goes wrong or even when something is changing. So we have to also work as a team with the owners, because they know most of the times better than you about their pets. So of course, a part of that, some weird clinical signs or aura before the seizure, they always have to lose the consciousness. Okay, this is the main difference between other diseases, for example, movement disorders or few head tremors. They have to lose the consciousness, okay, or at least have a completely abnormal mental state, and they have to have what we call autonomic clinical signs: salivation, urination, defecation. This is pathognomonic of a seizure, okay? It's super important. And then, of course, they have to be in lateral recumbency. They have to have some pedaling. Sometimes they feel a little bit more stiff than the pedaling itself, and they need few minutes to recover, okay? So depends on the pet. The seizure can be a little bit different, but most of them, they follow the same pattern.
And some people kind of have an issue distinguishing between the dog's dreaming, let's say, and the seizure.
Yeah.
But as you're kind of saying, cannot be just like 2 or 3 symptoms that they're asleep, maybe urinating.
Yeah, exactly. Like it's not that you have to have 100% most of them, but I can say that 90% of my pets with seizures, they have salivation. Sometimes urination, defecation is not that obvious, and sometimes we don't have those signs, but the salivation is always there. Even when you have partial seizure, sometimes they feel like they are here, even though if they are a little bit confused or disoriented, and you can see the saliva dropping. So yeah, this is very, very interesting, because sometimes even with a video it's easier. They feel so nervous that sometimes they cannot really distinguish between one thing or the other, but that's my job. So I always ask for a video so we can be 100% sure if we have a seizure, we have something else.
That's such a good point. And you kind of also mentioned about like after the seizure, they have like a slight change of mental state.
Yeah, they always feel very tired. At the end, we have to understand that during a seizure, they consume a lot of energy and glucose. So even most of them, if they are a little bit groggy, I would say, they try to drink, they try to eat because they need to recover that energy. They are pretty smart. But yes, sometimes they have some abnormal mental state that can last for a few hours. We only consider something as an emergency if they cannot even wake up from the seizure. But we have to give them some space, or even sometimes when they feel they can be aggressive, okay, that's a sign that you have to treat them because, of course, can be dangerous for the family, but usually something transitory.
And that exactly is my next question. So if this happens to pet owners and it's the first time their pet has had a seizure, people always want to know what to do. And there's a lot of like misunderstanding of what they should do. There's even like this concept that you have to like be careful they don't choke on their tongue. And people are like putting their hands in their mouth, or people don't know, like, do I bring him straight to the vet while he sees like... What should people do if it's the first time your pet has a seizure? What are the kind of few things you should do one by one?
Of course, no one will record a video at that time because we are panicking.
I was going to say, you really should, but I can imagine nobody does that.
Exactly. Ideally, for me, it's going to be super important, but of course, for them, they are in shock, they are panicking, and most of them, they think that their pet is dying, which is really, really overwhelming. So I will say that just to make sure that around the pet, you don't have anything that can hurt him, or at least he can hit by a chair or the sofa. Never, never, never we have to put our hands inside of the mouth. They will not choke, okay? That's, I don't know who created that rumor, but it's not true. And actually, as I said, they have some rigidity of the muscles, even that can affect the jaw, and you can really be hurt by them by accident because they are unconscious. So they just close their jaw and you can lose a finger, okay? So you have to be really careful with that. And I would say if it's the first seizure, 100% we always consider that as an emergency, okay? It's not the same when you have already a patient that with the diagnosis, that we know that can happen time to time, but the first time, you don't know if it can be because of hypoglycemia, if an intoxication, even a head trauma. So it's always really important to go directly to the vet to check that the first seizure.
And should they be waiting until they're finished with the seizure, or like how long can this last, the seizure, for the first time?
Well, I think most of them, at least the owners, when the dog is or the cat is having just a seizure, they cannot really think to bring them up. They are extremely in shock, I will say, and even actually most of them, even in few videos, the poor things, they are crying because for them it's really, really hard to see their pet like this, even though for them it's not painful. They are completely unconscious.
But that's the thing, I think a lot of people, thank you for kind of addressing that, they see it as a painful thing, or they see them thrashing and they're worried they're going to hurt themselves.
No, it's not painful. Of course, with the movement sometimes they can hurt themselves, but nothing dramatic. They are not going to break an arm or a leg. No, that's not going to happen. But I will say, I will just make sure that the patient is stable. If it lasts more than 3, 4, 5 minutes, don't wait, okay? Pick up him and bring him to the bed. But if it's the first time and it's just few seconds, even less than a minute, wait, make sure that the patient is stable, and then bring him back to the hospital.
And people, I think, for any emergency, for some reason, everyone's like, give him some water. Like,
no,
okay.
No
water,
don't do
no
anything,
food.
no, because they are not, or I will say that their mental state is not 100% normal. So if you are forcing them to drink water, they can have an aspiration pneumonia. Even with their own saliva, they can have an aspiration pneumonia because they cannot swallow properly. So really, don't do much. Just make sure that the patient is not hitting himself with anything around him, and just bring him to the bed.
And you made another really interesting point about how to know it's an emergency. If it's the first time that they've had the seizure, it's automatically an emergency. For people who have the pet has epilepsy, how do they also distinguish when this is an emergency? This is not usual. Okay, they're having the seizures very often, but is there any criteria you have where you're able to tell them this is when you need to come back?
This is really important, and actually something that we discuss in the first consult, so all of us can be aware. I always say that if it's, as I said, the first seizure, as you said, go directly to the vet. We consider that an emergency. If we have a seizure that lasts more than 4 or 5 minutes, or even if you know the pattern of your pet, and we know that it's only 20 seconds usually, and it's 2-3 minutes, that's different. Something has changed. You have to bring him, okay? Or for example, if we were saying before, after the seizure, they are completely unconscious, they cannot recover, or they are extremely disoriented for more than 6-5 hours. That's not normal. We have to see them. And of course, if we have more than or multiple seizures in 24 hours, what we call cluster seizure, all those 3 situations are considered emergencies.
So even more than one. Once you have the second one in 24 hours, it's now an emergency.
That's not normal. You have to bring him so we can check him.
Okay. So the pet has a seizure and they come to you. What's the first diagnostic steps a vet would take?
I will say, of course, first of all, you have to stabilize the patient, make sure that you don't have or you can stop the seizure. We always advise, of course, to place oxygen and just to make sure that the glucose is stable, because as I said, a lot of patients, just because of hypoglycemia, they can develop seizures, and it's not a neurological issue, even though if you have neurological signs. So it's a primary internal medicine problem, I will say. And I think after the pet is stabilized, I would say the most important thing is to chat with the owner to make sure, hey, what happened? Is the first seizure? Is the pet having any medication? Any chance to have intoxication? Any head trauma? Any previous condition? So you can try to distinguish between one or other scenario. And after that, I would say physical examination is more important than the neurological one. Minimal databases in terms of blood tests, nothing crazy, okay? And then if you feel comfortable, you can jump to the neurological examination. But the neuro, I would say, is the last step because because you have a lot of diseases that can produce seizures. So you have to make sure in which situation are you, because they are not treated by the same way.
So easily pigeonholed to neurology every time. And what role then do you've done the neurological exam, you've clarified that it's a neurological problem. What role do imaging take in the diagnosis process, like X-ray, MRI?
Yeah, well, X-ray for me is not really important unless you have a head trauma. Maybe you can do an X-ray to make sure if you have any skull fracture or anything that can affect the parenchyma itself, the brain. But that's all, I will say. Like imaging in terms of neuro, I will say more advanced imaging as MRI, okay? MRI is the gold standard test to check the brain and the nervous system, not the CT scan. Everybody wants to do a CT scan, and I don't know why.
Can you just clarify as well?
Yeah.
The MRI is for the nervous system and the brain. CT scan is for?
Yeah, we can check with the CT scan the organs, the liver, the lungs, even though few bleedings. For example, if you have a head trauma and you think you have an internal bleeding, even though if it's inside of the skull, the brain, CT scan is the main one. But the rest of the pathologies is MRI, okay? So CT scan, it's a very fast test, but you cannot really check the full brain. So most of the times you can check few areas, but the backside of the brain, because of the thickness of the skull, it cannot be checked by CT scan. So you miss half of the information. So MRI is the gold standard test. So yes, it's very helpful. So you can understand if you have something else, as I said, something intracranial, a tumor, an inflammatory disease, something congenital, because most of the times the idiopathic epilepsy, the genetical epilepsy, is diagnosed by ruling out other disease, okay? Even though we have some genetical tests, but they are very expensive and they are not even available for all the breeds. So yeah, it's really needed, and so the CSF, because it can give you a lot of information regarding the inflammatory situation
so
of the
CSF,
brain.
just for everyone listening, would be the spinal fluid tap?
Yes, okay. It's that liquid that we have around the brain, the spinal cord, that helps with the nutrition, with the oxygen. It's a supportive liquid, I will say. So when something changes inside of that central nervous system, this liquid is going to change. So even though sometimes the MRI looks pretty normal, if you have some changes on the liquid, it means that you have something else, okay? So yeah, they are complementary tests, they are really important.
And how important is it for people, again, once we've ruled out internal medicine, it is epilepsy. How important is it to see a neurologist compared to a regular vet? Or like what would be kind of the difference if people are wondering, can my general vet not treat it? It's been confirmed, it's diagnosed.
Well, I think once you rule out, as you said, that is not an internal medicine problem. The main concern that I have here is that, as I said, most of them, they are just epilepsy. And epilepsy is a very wide name, and you have to make sure if you have something else, because most of them, they reach to me when they are really poor control, okay, in terms of medication, and it's because we are missing 1,000 steps between the GP or the internal medicine and me, and sometimes they are misdiagnosed, and you are wasting time, and you can have a really critical situation. So I think that's the main difference. I think we should work together. They have to reach until this point, and when it's not their field anymore, or when they don't feel comfortable, I need to say, they have to refer it, or we have to investigate more to treat the patient correctly. At the end, it's on their behalf.
And do you have any personal stories that you've seen actually of the people coming to you with epilepsy?
Oh yeah, a lot.
What is it often, or is it just completely different every time?
Yeah, no, to be honest, most of the times, well, I would not say most of the times, but I have very, very curious cases where they just come saying like, my dog has epilepsy and actually is not responding to the treatment, and look, the video is clearly epilepsy. Is like, this is not epilepsy, this is a movement disorder, and for the last 10 years you have received an anti-epileptic medication when it was not needed, okay? So they are in shock, and actually they are really scared to stop the medication because they got used to that, even though if it's not working, because it's not working for this kind of movement disorder. So that's why it's really important to have a diagnosis, because also the medication has side effects, and the owners get really obsessed with the timings, which they do correctly, but at the end, for 10 years or more than 5 years, few pets, they are being treated for epilepsy when they don't have epilepsy.
Wow.
Yeah.
Crazy,
yeah.
I'd like to get into the treatment then. So what are the main treatment options for pets with epilepsy? I know that's probably such a broad thing to ask.
I think we can have another podcast regarding the medication, but we use anti-epileptic medication. We have different options, depends on the if it's a cat, if it's a dog, they don't respond the same way. Few medication for cats, they can be really dangerous that they are while using in dogs.
Which medications would those be?
For example, potassium bromide. Potassium bromide is a medication that works pretty well, I will say, as a second line in dogs, but it can produce some kind of respiratory diseases in cats, and they are not. You should not use it, and I have a lot of patients coming from other clinics with this medication and with respiratory signs. It's like, this is not even the first line. So depends on the case. You have to understand which medication works better for that patient, and it's not even for the patient, it's also for the owners, because are you able to give medication every 8 hours? Are you happy to even give it every, 12 hours, but extremely strict? We have to speak also about the economical part.
Is that something that you decide with the owner how often it will be given? Like if you're not going to be able to, you kind of mentioned it earlier, but the timing is so strict. So if the owner is not able to do the 8 hours, is there a possibility to change the timing, or it's just you have to make this work?
Not really. For example, with phenobarbital, you don't have much options. That is one of the main treatments. With other medication as Keppra, it can be, you can even try every 12 hours, even though if it's not ideal. But yes, you have to try to adapt your protocol to each owner, because at the end, even though if the patient needs something, if the owner cannot make it or cannot afford it, at the end the patient is going to suffer. So even though if I need to offer what I think is the best for the case, we have to, as I said, it's a team, we work as a team, and the owner needs to be happy to continue with the medication, of course.
And can you explain very easily for everyone to understand, how does anti-seizure medication work, and what are the long-term effects of them?
Well, I will say that the medication just decrease the brain electricity. I will say decrease as much as possible that peaks of electricity that we have when we have seizures, that they cannot be controlled by the brain. And yes, of course, we have side effects, okay? Few of them, they are quite safe, as levetiracetam, the Keppra, but phenobarbital is one of the most common medication that we use, and one of the medication that all the owners are really scared to use, because they are aware about the liver side effects, the sedation, and yes, you can have it, but usually they are quite transitory and they are manageable, So sometimes we want to have everything perfect from the first day, and it's not possible. In neurology, this is not possible. So they have to be patient.
Yeah, people love to have a timeline, and it's like neurology, like forget it. Anything can go.
Yeah, I wish I can give you that. But yes, at least we need a couple of months to settle everything and to find the protocol. And it's true that sadly sometimes, as I said, few breeds or few patients, they don't respond well to the medication. But I need time to reach that point, or to make sure which dose or which medication fits for each pet.
And can pets live normal lives with epilepsy, or are there lifestyle adjustments owners need to make? Or
I would say more the timings of the medication, but the pet can do a perfect normal life. Actually, they are always scared to do some exercise, to play with them, while actually the seizures happen mainly at night or when they are resting. So they can do perfect normal life, just to make sure, even if they are in a pet hotel or any kind of shelter, to make sure that they give the medication on time. But that's all, okay? They can do pretty much a normal life.
That's so nice for people to know. And for owners at home, okay, how do they people love to kind of do things at home to like help the situation or so on. Is there anything like you see that works, you could actually do that at home that could help, or you see don't do that at home that doesn't help?
No, I would say just to be, just to help your pet, as we said before, to avoid any kind of trauma. But apart from that, sadly, we don't have much more options. We have some medication in Europe or even in US that can be given when we have a seizure, or maybe when we have a cluster seizure that we were discussing before, but it's not available here. So we cannot do much in that case.
And is there anything they can do to stop the trigger, like prevent triggering of seizures, or not necessarily?
Yeah, for example, I have few cats that they respond. You know this noise that you do when you are using a plastic bag, that you just make a tiny ball and you put it in a drawer. So that sound of the plastic.
This is so precise.
Yeah, but it's true because cats are
just a plastic bag.
It's
roll
a plastic
it up.
bag.
Okay.
Yeah. So it's mainly in cats. Dogs are not like this. Cats are very special, I would say. But yes, most I will not say most of them, but when they are triggered by a sound, is this kind of plastic bags. So of course, ideally, try to not do that. Exactly, use a paper one, or try not to do that in front of the pet, or even, for example, as we were saying before, the Lafora disease. Try to avoid the intense light and to make sure, at least, even though sometimes they buy this kind of glasses where they are very cute, so you can avoid or reduce as maximum the seizures. But sometimes there's no much you can do.
All right. Can you tell us a little bit about future research then? Are there any promising new therapies or research in veterinary neurology for epilepsy?
Well, this is well known in human medicine. I think we are a little bit slow in that sense.
We're always catching up with it.
Yeah, but also we learn a lot from human medicine, which is great. We have some surgeries, for example, in human medicine, they localize the seizures with electroencephalomyography, that they just put some electrodes in your brain and they are understanding which areas of the brain is this peak of electricity is being produced, and they try to remove surgically those areas so you don't have any more seizures. It's mainly the cortex. Don't mind that we are taking an important part of the brain, but in veterinary medicine is so invasive that most of the owners, they don't even think about it, because you can have a lot of complication. And again, we don't have that experience, okay? Or even we have some pacemakers or device.
I don't know anything about it, but in humans, is it done then when the human is awake, so that they can control, like they're in the right part of the brain?
No, they
do
this kind of test before the procedure, and then they remove it surgically. Yeah. And the other one that we were discussing is some kind of a stimulation of the vagal nerve that always try to decrease the response of this brain hyperactivity. And it's a device, it's something like a pacemaker. It's super easy, but it's extremely expensive. So again, in veterinary medicine, we are quite limited in terms of the economical resources of each owner.
And do you see epilepsy management evolving in the next 5 to 10 years?
Well, hopefully, yes. Because it's true that I think we are playing with the same medication for the last few years. Hopefully these two surgeries or this kind of two more invasive procedures, they are going to evolve in some point, that they are going to be more accessible. And actually, we have some other therapies, alternative therapies, I would say, well studied, for example, acupuncture, and you can even speak about it more than me. But yes, sometimes if you just stimulate few areas of the body in refractory patients, you know that they are going to or reduce the amount of seizures, or even respond better to the medication. And the same with the new diets that we have. The ketogenic diet is well known in human medicine. We just started for the last few years. But we know that this kind of diets can help also in order to control the seizure activity, or even other kind of degenerative disease that can affect the brain.
It's interesting though. A lot of them go so well, like hand in hand together, and sometimes the owners maybe want to like stop all medicine and just try these kind of other options. But it's like the best effect will be hand in hand. Like do the medicine with this, and we can reduce how much we need the medicine, or it will work even better. But
then we have to understand that the medication is mainly, of course, ideally to stop the seizures and have a perfect life, but this is not the reality. The reality is that we use the medication to decrease the frequency of the seizures, the intensity, and even those side effects that they are not desired. For example, the aggressiveness that we were discussing before. But we have to be realistic, and the medication is the baseline, and then you can add on top of that other kind of therapies that can be really helpful. But the medication is the basic one.
Gotta stick with that, please.
Yeah.
What's one piece of advice you'd give to pet owners whose pet's just been diagnosed with epilepsy? That must be such a hard kind of, like you said, everyone gets shocked. You know what it is. What's one piece of advice? I think
epilepsy is one of the hardest disease, at least at the beginning, to be handled. Most of my owners, they cry with me in the consult because the poor things, they are really overwhelmed. And I think this is the first feeling that they have at the beginning. But I always tell them, like, really, be patient, work with me. This is a teamwork. And most of the time, since just few weeks or few months, they get used to it, they can handle it. So the beginning is really hard, but then they become more specialists than me. So yeah, they can really do it. They just need to be patient and be positive.
And just to wrap it up then, is there any myth you want to dispel about epilepsy, or kind of one thing you wish owners would stop believing regarding epilepsy?
Well, I need to say that most of them, they come to my consult quite desperate, either though because they are coming from another place where the seizures are not that controlled, but most of them, they have really open mind to change things, to try, to be patient with me, because sometimes it's super frustrating for them to see that the things are not going well. But I will say that few homeopathic medication that they are using, we don't have enough studies regarding that, so it's not going to be never my first line of treatment. I think the diagnosis should be done first, even though when they want to jump to the treatment. So I think they just need to make sure that we follow a protocol, and that's why we have in medicine, in human and veterinary medicine protocols. So they just have to trust me. Yeah. I will say that. But yeah, thanks God, that's good. Most of my owners, they are really good on that, and they really follow my advices.
Thank you so much for speaking with us today, Dr. Cristina.
Was a pleasure.
That was so helpful, I'm sure, for so many pet owners. Is there anything you can advise people if they want to find out more, if they want to learn more about epilepsy, or any kind of general advice you can tell people to search here, or is it?
Yeah, well, I can. We can give some links regarding the epilepsy. I think, if they want, they can find on internet, in the good places, of course, a lot of information. Nowadays is a very common and famous disease. Almost 5% of the pet population, they have epilepsy, real epilepsy, idiopathic epilepsy. So yeah, I think the information is almost everywhere. Even when you buy the medication, you have some advices there. But yes, if they have any question, they can reach out to me.
Amazing. Thank you so much for listening, everyone, and thank you for being with me.
Of course, it's a pleasure.
If you have any more questions for Dr. Cristina, or any more topics you want us to discuss, just let us know in the comments, and be sure to subscribe. Thank you.
Thank you.
You're so good at speaking.
My God.
Actually, yeah.